If I show up to a birth without this, I feel naked. Hey everyone, my name's Lavonne and welcome back to my YouTube channel. A bunch of years ago, like very early on in my bundle birth days, I did a what's in my doula bag video, and I am back because I have now at least 7 years under my belt as a doula or a birth coach. And so I have a few things to tell you and some revisions or additions or flexing and flowing through my doula bag. And so if you are a birthing person, if you are a partner, if you are a doula, this bag is for you. I'm gonna give you my top 5 things that if I had to fly out of my house in a fury and not lug my entire doula bag with me, these would be the 5 things that I would bring that are, I would say, most helpful to help support my clients when they're in labor. These are things that you can bring for yourself and doulas. I would suggest having in your bags as well. And so without further ado, my doula bag is still one enormous and still the exact same bag that I have been using for a very long time. This is a Lululemon. I got a very long time ago. I love that it's a duffel. I love that it's light. I've seen doulas like roll in suitcases. That's not my vibe. If you bring your suitcases, please bring your suitcases. That makes the most sense. But this is what I bring to every single birth, and it has a lot of stuff in it. Now, some of which you're gonna see me like take out, such as a rebozo, because that is not in my top 5. There's a lot of things in here that I actually skipped for this video that are like personal items for me. And so if you are a doula, if you are a partner, you're someone going to a birth, you need your essentials as well. In fact, like even a toothbrush, toothpaste, change of clothes. When I'm on call, I have this in my trunk. I'm actually on call right now. So yesterday I went out and this was not in my trunk and I was feeling very stressed about it. So it's going back in after this video. And so I need to be able to stop and drop and change. If I was out on the town in a dress or in heels or something, like I need clothes that I can show up appropriately to a birth with. So that was not included in this list. But there were some things that when I finally narrowed it down, I'm like, oh, if I show up to a birth without this, I feel naked. My other caveat for this is you really don't need much. And so even as I was thinking about this, I could like argue both sides of like, I need these things. And also you really just need your hands and you really just need your presence. Okay. So if you're a partner, a doula, remember that like, especially newer doulas, I see them like pack up their bags and they're like full of all sorts of things. And really, like, it's nice to have. I don't use everything in this bag at all, hardly ever. And what really has the most impact when you're supporting a birth is your presence, your heart, your love, your encouragement, your hands. You can do a lot with what you got. And so, though, without further ado, my number 5, I'm gonna go backwards because it's also sitting right on top, is that I find very helpful that I pull out more regularly at a birth is a rechargeable little portable fan. I will say this one's more ugly than the one that I have in my bedroom, and I've considered switching them out because I like love me an aesthetic moment. But it does have 3 speeds. While you're in labor, it is very common for your temperature to be like hot and cold and hot and cold, and especially when you're working so hard, it's like you're constantly asked like, I'm so hot, and then you want to be naked. And so a lot of times I will grab something that is like firm and I'll just grab this or like a glove that's at the bedside or something hanging around and I will fan them off. Now, my arm, I love a good workout, but this for 12 hours is a lot, okay? And so like we'll pass this back and forth, me and the partner. And so instead you just, there you are. Nice little breeze, fanning moment. It's nice. Fan is number 5. My number 4, which this one I also contemplated on this list because I like created all of this content and like I've put my brain in an app for nurses and all of that, but I do still find myself reaching for our bundle birth position guide. Now, mind you, we have a lot of tools but I didn't choose them. My favorite tool that I like to use with people is our position guide. Now, this is for sale in the store. If you are a doula, this is like one, and honestly, that and then our bundle birth education guide are 2 things that like are so incredibly helpful to have at the bedside. Now, you're getting a bonus with the education guide because again, this wasn't on my list, but like flex and flow, that to be able to talk about different things and give the client or the patient a visual of them is so incredibly helpful. This came from my brain of like being in the hospital and having to like use my hands of like the cervix is like thinning, and like that's not a visual. And for people who don't even know what a cervix is, they're like, okay. And so instead I can give them actual pictures. These are things that I have actually drawn. There's information on an epidural, on inductions, on your rights as a patient, super helpful for your bag. But the one that I love to actually use myself a lot too is hand you your menu of positions. If you've seen any of my videos, if you've taken my physiologic birth class for nurses, if you're a nurse or a doula, doulas, you're invited to that like one of the things that we can control that is a tangible thing that actually helps labor progress, speed up, etc., is position changes. You should be changing positions about every 30 to 60 minutes, even when you get an epidural, and actually especially when you get an epidural, because if you're laboring without an epidural and you're uncomfortable, you're likely changing positions on your own, you're listening to your body, etc. But especially once you get an epidural, based on where the baby's at in the pelvis, we can strategize what positions you get in to help optimize or create space for where the baby needs to go, get into the pelvis, lock and load them, get them out the bottom. We want to be strategic about that, and this helps you do that. So I will hand this to a client and be like, hey, based on your cervical exam, we're on this page. Here we are. And so do any of these positions sound good? And what's helpful about this is I could say like, we could turn you left with your leg up and with the peanut ball, and like, you know, I'll kind of like contort your hips a little this way and we'll tuck you in with pillows, and you're like, okay, that's not helpful. You can't visualize it. Whereas with this, you're like, oh, ooh. And a lot of times what I see patients do, they'll be like, oh, that's nice. Ooh, that looks really good. And they know. And so it gives you control, gives you options. If you're a patient and you bring this to your birth and you're done having babies, leave it with your nurses as a nurse gift. I love that idea. Position guide is number 4. All right, my number 3 is any kind of essential / massage oil. Now, if you have been trained in myofascial release, you don't want to be slippery. And I am trained in myofascial release, but that's pretty uncommon. And in fact, you're probably like, what even is that? And so flex and flow. But massage in labor is a fantastic way to connect with your partner, to help support them, to help release oxytocin, because touch and that connection help release oxytocin, help increase your contractions. And then any kind of massage helps soften the fascia. You should watch my fascia videos on that. We'll link them down below. That will give you some context for why that touch and massage is so incredibly important. We do have a massage guide in our store as well. And so that is really helpful for the partners. A lot of times I'll like grab this and be like, here you go. And then you have a guide and like a way to help with massage, because what happens with massage, and again, what's really important to me when I'm supporting a birth is, one, that you feel connected, that you feel emotionally safe, that you don't feel alone. I also want to help set up your body for vaginal birth success safely, right? And I want you to cope. Those are kind of 3 brackets that I'm constantly thinking about. And so I will say all of these things I think hit all 3 of those. And especially with massage, you're actually helping soften the tissues. And when you soften and engage the fascia anywhere in the body, it helps the rest of the body realign. And so partners, a lot of times, like you'll do a foot massage or a hand massage and you're kind of like, oh, it feels nice. It's more than just it feels nice. It actually helps release the tissues. And so without further ado, I do have a massage blend. I'm going to give you this in this video. It is a combination of doTERRA, Serenity, Balance, and Grapefruit with 1 drop of clary sage. And this combo, when I smell this, it's like I'm at every birth I've ever attended. And I sort of have narrowed it down to this and a Soothing Scents pen, which this one's new because the other one I have used so much that it like completely died. And then I've stolen it for like my purse, and I'll like find these little pens everywhere else. But what I love about this, especially as a doula, and I will link them also down below, is that a lot of times with oils, they get a little bit messy. And like you're like, if you're not doing massage, then I'm like putting a drop of essential oils on my hands and being like, or putting it like behind a fan or something, you know? Whereas with this, what I love about the way that this delivers is it's like in your pocket or it's around, and they have a little hit of nausea, because this is specifically for nausea. It's called Quiz Ease. You pop it open. It's so nice. and they're like, that's nice, I feel better. I don't want it anymore. Boom, away, saved, reusable, the best. I think they're so helpful for hospitals. They sponsored our Move Learning Retreat, and they were the only ones that I actually let come to the Move Learning Retreat because I believe so much in this brand. So as far as essential oils go, you want like yummy smells, help create an environment, and it does actually trigger the olfactory nerve in the brain and help you cope in that way. Great. And then the other one I have is just a basic plain coconut oil, and it's a fractionated coconut oil, so it's already like watery, not like the thick one you get and you use like for cooking or whatever. And I put it in a spray bottle because when I am going to massage, to like open up a cap and then dump it out, and now it's like spilling everywhere. The spray to me is just so easy. I put a little, I'll like spray it mostly on my hands, use it for massage. It absorbs. It's like organic and clean and not going to cause irritation and nice for your coping. My number 2 I talked about in the fascia video is our spiky ball. So we actually started selling these in our store, and mostly because I had done a physiologic coping class for nurses, which is still available on our site. And it talks about the physiology, or like the like way the body works to help you cope, and how that actually helps set you up for a vaginal birth and speed up your labor, make it less painful. Obviously, that's what coping is for. And so what this does is it is a distraction for your brain when you're coping. It also helps release natural endorphins, which are your coping hormone. And so I talked about this in the fascia video, but now I will say this, and the next thing I'm about to show you, if I was literally running out of my house like a psycho and I'm like, I forgot my bag, these are the 2 things, or I was traveling, which actually did happen to me at one point. I was like rushing to a flight and I couldn't bring much, and I grabbed these 2 things. It's a spiky ball and the next thing, because again, what I find is it's painful enough, but it's not painful. It's like acupressure and gate control theory, and you're like engaging the fascia, and it's distracting for the brain to the point where people will set it down sometimes, and then contraction will come and they'll be like, where's the ball? And they go looking for this. This one, of all the things, and I have like lots of other tools. There's candles in here. Yes, bring those too, flameless. But like this is the one that they attach to and then are like stuck with for the rest of the time. So get yourself a spiky ball. I'll link it down below. Super helpful for your labor, birth, life, coping. Even now it's kind of addicting, where I'm like, I want more of that sensation in my hand. It feels really good. And then without further ado, if you've followed me for a long time, I will say that like before I actually started talking about this, I didn't see these twinkle lights anywhere in births ever, but I would bring them to births and people would walk in the room. You add a little essential oil, you have the little candles, and then you walk in with these like the perfect, like dark, soothing lighting, and people, the nurses, the doctors would walk in and be like, oh, it's so nice in here. Right? And we know, if you're a nurse, you know, you're like, that room, that one's, I just want to hang out in there because it feels different in your body. And so my biggest suggestion for you are a copper twinkle light. What I love about this is they are battery operated. And again, I literally just restocked this because mine went disappearing. They were probably left at a birth, to be honest. But what happens is it's battery operated, so you don't have to worry about a plug. You don't have to worry about electricity, which is really nice. But then they're so subtle that what I do is I will like find a place to put the base of this. And then I have a few of them, and I will just put them, like I'll bunch them in the bathroom if they're like gonna be taking a bath or something. These are a mess. I just completely created a nightmare of this. You get the idea that like you spread them out, and somebody else is gonna have to fix this. Sorry to the team that's in the room, but you like spread them out, or I'll tape them to the wall like across, and it is the perfect ambiance. It's super low cost. It's super tiny for your bag. It's like nothing. I can throw this in my purse. So I would grab a spiky ball and this, run to a birth, and then this sets the ambiance. This helps with coping. It helps with endorphin and gives that distraction. And then I have my hands. These 2 for sure would be my top 2 things that I would personally bring to help support a birth. Now that's not all, obviously. So if you want the full gamut of what's in this bag, please let me know in the comment box down below. Let me know if you're a doula. Let me know if you're a nurse or a patient, birthing person. I do have other things in here, but again, like Are they essential? I want you to remember, especially if you're supporting a birth, that like your presence is the most important thing that you bring to a birth. And again, there are times when like I literally don't even open my bag because I'm so connected to and in it with and like available to and impacting my patient or my client in that way without all of the extra supplies. Are they helpful? Sure. Are they essential? Probably not. But again, I would definitely recommend just at least just like a little twinkle light, set the mood. You have control over those little baby things. This is only the tip of the iceberg related to how to cope and things you can control. You will learn all of that and more in my bundle birth class, and then of course my coping with labor class. If you're a nurse, if you're a doula, you're invited to our physiologic birth class. You can check that all out at bundlebirthnurses.com. We do a lot of things. We just want to support you to have the most positive birth experience possible. So with that, make sure that you subscribe down below, like it, share it, comment your favorite takeaway. What did you bring or what do you bring if you're a doula that like really helps you, that are your essential items? And then until next time, don't forget to flex and flow, and I will see you soon. Bye everyone. It's not cute, but you know what? It's functional.